My name is Brianna Carl, and today we're looking at Chapter 11, Employee Assistance Programs. This is a quick overview of what we'll be looking at in today's presentation. We'll be looking at Employee Assistance Programs, EAPs, effectiveness for small businesses, the EAP's impact, mental health care, dealing with anxiety, and we're also going to look at how it ties in with COVID-19 today. Employee assistance programs' effectiveness in small businesses is a little bit different than what it would be in larger businesses. Zhao 2017 did his research in China and found that Chinese EAPs is unique for two reasons. There's a less focus on alcoholism and a strong involvement of group counseling and enterprise collective mental training. I found that interesting because that is the direction I see a lot of businesses in the US heading towards when it comes to EAPs. So there are 4 factors for successful EAPs in a small company. According to Zhao 2017, now some suggestions are presented for making EAP more effective in small startup company. A successful EAP in a small company is determined by 4 critical factors as follows. Support for the EAP by management department and the boss, clear and well-defined statement of confidentiality, group counseling and group training, and a skilled counselor. So what are some EAP impacts? Well, according to Malot 2020, over the last 6 years, new research studies have been conducted with the goal of advancing the understanding of the value and impact of EAPs on employee mental health and work functioning. The study conducted by Malot 2020 found that employees in the EAP group, when compared with the control group of non-EAP users, reported the following: lower levels of anxiety and depression, lower levels of overall psychological distress, lower work presenteeism and work-related distress, higher work engagement, greater life satisfaction as an indicator of improved well-being. Malot says these findings provided strong evidence in support of a causal link between use of the external EAP and improvements in employee mental health and work functioning. Malot 2020 also says, taken together, the findings demonstrate that impactful EAPs can be well positioned to help employers address psychological health in the workplace. In my research, mental health care is becoming a more common theme. So Chung et al. 2019 became concerned with mental health care in EAPs when they learned that burnout has found to affect nearly 70% of emergency physicians and up to 76% of emergency medicine residents. Of the 28% of residents who screened positive for depression or depressive symptoms, only 20 to 40% actually seek treatment. Some barriers include time, confidentiality, and stigma. These percentages prompted them to perform their study. The study conducted by Chung et al. 2019 found that a study of internal medicine residents who attended an opt-out universal well-being assessment at the Employee Assistance Program reported increased likelihood of using EAP in the future. Chung et al. 2019 also saw in their preliminary results that this intervention may be effective in increasing the likelihood of future EAP use for residents who attend an appointment compared to those who do not. Now that we see employee assistance programs can break the mold and stigma that goes with only being useful for people with alcoholism or other substance abusers, and can be adapted for those suffering from mental health problems like depression and anxiety, we can see how EAPs can be useful during COVID-19 and the pandemic. We'll be looking at Geisler 2020, who looks at how business leaders can work to help ease the pandemic-induced stress and anxiety among employees. Nurses are also dealing with life-saving adjustments to the way to how they work to save lives. So we'll look at Donahue, Ryan, and Schneider and how they explore ways medical personnel are coping with anxiety during COVID-19. Dealing with anxiety. In light of today's society, Geisler 2020 wrote a column to help managers adjust to higher anxiety levels among employees. Geisler 2020 advises, under these circumstances, it's more important than ever for leaders to be present and transparent in the calm in the storm. So, how do you cope with anxiety at work? Employees look up to management for leadership and guidance during uncertain times. Geisler 2020 notes that open-door policies may not be enough. She explains some employees are not comfortable walking in and airing out their fears and anxieties to their employers. Instead, she points out ways many companies have adapted to reassure their employees feel secure. Geisler 2020 says, they are emphasizing employee health and safety not out of mere compliance with government guidelines or fear of liability, but as a demonstration of genuine care and concern. In no industry does this emphasis resonate more in the current environment than it does in healthcare. So turning now to healthcare and the medical staff working in high stress environments during the COVID-19 pandemic, Donahue, Ryan, and Schneider 2020 explain the stress nurses and other first responders are under right now. They say healthcare workers, nurses, providers, and support personnel are experiencing severe stress while caring for patients infected with COVID-19. They carry the extra burdens of infection risk, equipment shortages, and sudden practice environment alterations. Donahue, Ryan, and Schneider 2020 realize how this can put a toll on mental health by noting all of these factors compound any pre-existing anxiety condition, which is aggravated by overwhelming physical and mental exhaustion, stress from loneliness and isolation from their own families, dealing with death and dying in numbers not previously experienced by most staff, and worst of all, participating in allocation decisions about scarce resources as hospital census surges exceed the norm. As a result of all of this, Donahue, Ryan, and Schneider 2020 suggest trying the following coping mechanisms as a form of solution to some of these stressors and anxieties. Some of these include having an APRN that offers mental health tips, telehealth or telepsychiatric appointments, FaceTime visits with a chaplain for spiritual care, virtual workouts, mindfulness practices, mental health moments, or Caring for the Caregiver newsletter, which is offered by Donahue, Ryan, and Schneider. Donahue, Ryan, and Schneider 2020 say all of these strategies support the Atlantic Health System's Employee Assistance Program, as well as the Integrative Care and Creative Arts at Carol G. Simon Cancer Centers, the Healing Culture Council, and the Atlantic Health System Integrative Medicine Department. They say the plan has helped reduce the psychological impact of caregiver stress. And this cannot be stressed enough that our caregivers working in the medical field need the added support and employee assistance programs offered to them while working with the COVID-19 pandemic and also dealing with arising mental health issues that come with working the pandemic. This is a quick look at my references listed here. Thank you for your time, and I hope you have a wonderful rest of your day.